Welcome to Quick Medical Review, where we break down complex medical topics for students and professionals. In this episode, we focus on Kawasaki disease, an acute vasculitis that primarily affects children under 5 years old. We'll cover its anatomy, pathophysiology, clinical presentation, investigations, management, and prognosis. Kawasaki disease affects the blood vessels, specifically the medium-sized arteries, including the coronary arteries, which supply blood to the heart. It leads to inflammation of vessel walls or vasculitis, potentially causing serious cardiovascular complications. The exact cause of Kawasaki disease remains unknown, but it's believed to be an abnormal immune response triggered by an infection in genetically predisposed children. Inflammation spreads through the arteries, causing damage and potential aneurysm formation, particularly in the coronary arteries. Untreated, it can lead to coronary artery aneurysms, thrombosis, or myocardial infarction. The classic symptoms of Kawasaki disease occur in phases. Acute phase can present with persistent high fever over 5 days, bilateral non-purulent conjunctivitis, strawberry tongue, red cracked lips, and oral mucositis, rash on the body and limbs, often peeling around the groin, swelling and redness of the hands and feet, enlarged cervical lymph nodes, usually unilateral. Subacute phase can present with peeling of skin around the fingers and toes. Risk of coronary artery aneurysms increases. Thrombocytosis may develop. During convalescent phase, symptoms gradually resolve, but coronary artery changes may persist. Diagnosis is mainly clinical, but supported by laboratory tests and imaging. Blood tests may show elevated inflammatory markers like CRP, ESR, leukocytosis, anemia, and thrombocytosis in the subacute phase. Liver function tests and urine analysis may show abnormalities, but these are non-specific. Echocardiography can be done to detect coronary artery aneurysms and monitor heart function. Early treatment is critical to prevent complications. Treatment includes intravenous immunoglobulin. They can be administered within the first 10 days to reduce inflammation and prevent coronary artery damage. Aspirin can be used in high doses during the acute phase for anti-inflammatory effects and in lower doses later for antiplatelet action. Corticosteroids can be used sometimes with IVIG resistant cases. Monitoring can be done with regular echocardiograms, which are needed to assess for coronary artery involvement. With early treatment, the prognosis is excellent and the risk of long-term heart complications is significantly reduced. However, untreated Kawasaki disease can lead to severe cardiovascular issues like coronary aneurysms, which may result in heart attacks or require surgical intervention. In conclusion, Kawasaki disease is a pediatric condition that requires prompt diagnosis and treatment to prevent serious complications. Early IVIG administration drastically improves outcomes. Remember to monitor for coronary artery disease long after the acute phase resolves. For more information, be sure to check out guidelines from the American Heart Association. Thank you for listening to Quick Medical Review. Stay tuned for more essential medical knowledge.